Reveal Jesus, releasing destinies. This is Celebration TV. Reveal Jesus, releasing destinies. This is Celebration TV.
And as the elderly, countless times we have been told that health is wealth. While many may have already grasped the understanding, others perhaps find it difficult to explain the connection. It definitely takes a healthy body to make wealth. Or imagine spending your entire income just to stay healthy. I am Dr. Amy Momo. Join me and my colleague Dr. Keats on Health Talk, where your health is our priority, bringing you medical, professional, and essential health tips and discourse, exclusively only to Celebration TV, live every first and third Friday of the month, 2 p.m. to 3 p.m. GMT +1. Health Talks, your health. Sickle cell disease is a scourge in African continent, as well as other places like in the Mediterranean and the Hispanic. But about 80% of the sickle cell disease is seen in the sub-Saharan Africa, and 4.3 million of sickle cell disease are seen globally, while 114 million sickle cell traits are seen globally. So this disease ravishes the sub-Saharan Africa, of which our country Nigeria is part of it, and it's important for us all to know about this serious disease, sickle cell disease. And I am Dr. Amy Momo in Health Talks. Welcome to Celebration TV, and with me here is Dr. Kit Brahima.
Good afternoon, Doctor. Disease is a disease that is passed to an individual by two people, the parents, and it is the commonest hereditary blood disease that is seen. That's the commonest disease that can be passed by parents to their children worldwide. In a year, all over the world, we have about 300,000 new cases of sickle cell disease. Of these 300,000 births per year, about 150,000 occur in Nigeria alone. That means Nigeria accounts for about a half of all the new cases of sickle cell diseases worldwide every year.
And now, what is sickle cell disease? Sickle cell disease is a group of inherited disorder. And it actually affects the red blood cells. A case where the red blood cell is sickled. Normally, the red blood cell is biconcave, but in this situation, it is sickled and the disease.
Now, sickle cell anemia is an example of a sickle cell disease.
Yes.
Sickle cell diseases are plenty.
Of course.
Yeah, we have the sickle cell anemia, which is the HBSS, which is common, that people know that say one is SS. There's also the HBSC, is a sickle cell disease. There's also the hereditary persistence of fetal hemoglobin plus SC, plus hemoglobin S. But all those ones are not as common as the SS. The SS makes more than 50% of all the sickle cell diseases. Now, when we say sickle cell anemia, anemia is a shortage of blood in clear terms. And then we say sickle cell, normally, like you said, the cells have a particular shape, the red blood cells. They are supposed to be biconcave. They can pass through blood vessels smoothly without problems. But in the person that has a sickle cell, the shape of their red blood cell is different from other people's own. They take the shape of a sickle just like it is on the screen, and because of this shape, it cannot navigate its way through the blood vessel smoothly, and they easily die.
to add to this sickle cell anemia, because first of all, we know that the red blood cell have what we call the hemoglobin. The hemoglobin is the oxygen carrying moiety of the red blood cells. So this hemoglobin has an issue, has a mutation in it. And so oxygen cannot be carried through the red blood cells, through these red blood cells, because they die on time.
Yeah.
The normal red blood cells have the lifespan of 120 days. But in the sickle cell, that is the HBSS, which we are actually talking about or concentrating on in this topic, they have the lifespan of just 10 to 20 days. As such, there's a lack of oxygen, leading to so much disaster, so much terrible crippling conditions, which may eventually cause the death of the individual.
Yeah. Now, in sickle cell anemia, you find out that if you look at the statistics that we gave,
yes,
it is mainly a disease of the black race.
Yeah.
Africans, especially sub-Saharan Africans, for example, 24% of our population carry the AS genotype.
Yeah.
And it's common like that in Africans. Many of us are AS. And that was because God is wise. Yeah, when he knew that we are going to be in this region and there's going to be a lot of malaria in this place. Against the dangerous form of malaria. But along the line, it was now, because a lot of us are AS now intermarried, and then we now have some people coming down with the SS genotype.
Which is so unfortunate.
Which is now a problem for us. So that's why it's even black Americans too, we have the SS gene, because they also carry a lot, some of them are also from the AS genotype. Yeah.
Now, we talked about sickle cell anemia being, sickle cell disease being hereditary. And now, sickle cell anemia, of course, is part of the disease and is such. When a person, a man, is AS and marries a woman with AS, their children may have SS gene, that's hemoglobin SS. And I said, it's 25% chances. So, a couple can end up having all 4 children being sicklers, that is, having hemoglobin SS. And also at the same time, he might be lucky to have all 4 children being either AS or AA.
Which is possible. It's a common misconception. In those days, you hear people say, well, if AS marries AS, is only one of their child that will be SS.
Yes.
Now, they didn't understand the concept. Is that in every pregnancy, you have a 25% chance of the child being SS. You may be unfortunate that 25% takes precedence in all your pregnancies, and you find that all children will become SS. While some may be lucky, they will not even give birth to a child who is SS. But who wants to take chances and gamble with stuff like that?
One shouldn't gamble with such, because it's emotionally, physically, medically draining. So one shouldn't gamble with such at all.
Yeah.
There's a scenario, or I would say a patient of mine that, a patient of mine who came up and she had, she was telling me about her family. Her mom is 60, the father about 60-something years, and 6 children. None of them have this HBSS. They came in to check their genotype, and the mom and dad were actually AS.
AS, both of them.
Yes, AS.
So they were lucky enough to have escaped that, which is a possibility.
Okay.
But however, some people may not be that lucky. That having one SS child brings a lot of trauma to the family, and these things are what can be prevented, just like we have said. And we know that sickle cell anemia is one of the commonest cause of under 5 deaths in this part of the world. Now, of course, the incidence is on the decline a little because of science. People are now able to test, but some people still do not do investigations before they get married.
It's unfortunate.
Yeah.
It's unfortunate. Okay, we have the number on the screen. Feel free to call us. Ask your questions on sickle cell anemia or any other medical questions. We'll be here to answer. Okay, back to what we're saying concerning that. There was a patient of mine also who came up, and she's sickle cell. She has hemoglobin SS, and she has sickle cell anemia. And when I asked her some question, because of course we have to trace it, hereditary stuff, I realized that her dad is SS and mom AS, and they have just one child who's a carrier. The rest are all SS. So imagine this. But I feel so bad for her. In fact, now I feel bad, and I felt bad that day. But you know what happened? Those days there were no gadgets to check for this. Yeah. So our fathers, our mother just married like that. But now we should not be ignorant. We should not be ignorant, because there are tests. You can go to the hospital, have a test, and what? Avoid getting married to a career that's AS while you are AS, or to marry AS while you are SS.
SS. Well, and unfortunately, we still have like 20,000, 20 people in every 1,000 beds in Nigeria still come out SS. 20 out of every 1,000. So you see that even with technology, some people still just pretend not to know the problems that we are facing. But beautiful enough, many children who are SS do not die as it was in those days. If you read, in those days, there was a novel we read, a poem by John Pepper Clark, Abiku, that the child comes and dies, coming and going these several seasons, do stay out of the baobab tree. Now, those children were termed to be, the Yorubas call them Abikos, the Igbos call them Obanjes. Now, they felt that they were possessed. But many of them were actually sickle cell anemic children. Once they clock 6 months, they die. So they feel that hitting that target of 6 months was a recurrent death in those children, and they just classified them as evil, not knowing that it was because of sickle cell anemia. We have a call from Anthony from Kwara State. Good afternoon, Anthony. Welcome to Celebration TV Health Talk.
Hello, Anthony. Welcome.
Good afternoon, doctor.
Good afternoon, sir.
Yes, I want to make an inquiry about, it's not really about sickle cell.
All right.
It's about cancer.
Okay.
Yeah. For somebody who is living with, there's specific food that such person should avoid.
What type of cancer is the person living with?
Colon cancer.
Okay. All right. Okay. Yeah, for colorectal cancer, we know that there are food is a risk factor of colorectal cancer. We've said that we had a talk on cancer a while ago.
Yes.
Yeah. High fatty food is a risk factor for colorectal cancer. And we said that barbecue, roasted fish, roasted meat increases chances of coming down with colorectal cancer. And we say it's better people eat more of natural foods. Vegetables, high fiber foods that once you eat, you go to toilet, you pass it out. It's better than eating processed foods, these canned foods that we buy in the supermarkets and all that. So more of natural foods, fruits, vegetables, all right, and high fiber foods. Yeah,
and should avoid fine. Refined sugars also. Avoid refined sugars.
Yeah.
Okay, because cancer cells
they help. Yeah, they help to protect against colorectal cancer. But if the person already has cancer, it's something that should be managed in the hospital. They may tell them to do a surgery. If it is at a early stage, they can easily take off the cancer, except it has spread.
Yes.
Okay.
Thank you very much, sir.
Thank you, sir.
Thank you so much.
All right, sir. You're welcome, sir. All right. Now, back to cancer. We said that.
Sickle cell.
Yeah, sickle cell, sorry. Yeah. Now, we said that because people were dying like that, they felt it was because of reincarnation and all that, but which was purely because of sickle cell anemia. Now, most children that have sickle cell anemia at birth will not manifest.
No, until 6 months.
Yeah. They will get to 6 months before changes starts to happen.
Like hand and foot, call it hand and foot syndrome.
Yeah.
Where they have inflammation.
They will not manifest because, you know, within the first 6 months of life, they have a different type of hemoglobin that behaves normally.
hemoglobin.
Yeah, it behaves normal. It passes through blood vessels. It doesn't die as fast as the sickled one.
Yeah.
But once they start hitting 6 months, the genotype, the hemoglobin will change to the adult form of hemoglobin, and then the SS begins to express itself. They can come with pain, their hands and foot, swelling and pain on the hands and foot. The child will cry uncontrollably.
And if not properly managed, that child could die. So you can imagine those days, maybe the death was due to this hand-and-foot syndrome, and they might think that, oh, it's something else.
Yeah,
like
and the child starts losing blood. They lose blood because, like we said, because their blood are abnormally formed. Okay, we have a call.
Good morning.
Hello.
We can hear you. Good afternoon. Welcome, sir. Oh, unfortunately, I think we lost that call.
Well, I guess you'll call back.
All right.
Later. So let's talking about the triggers of this sickle cell anemia. Of course, we've said that it's a crippling condition and all these. So there are some things that can trigger these to come. Now,
for somebody who already has hemoglobin SS is a sickler. Some things will trigger up their crisis that they usually have. The commonest one that we have around is infections.
Of course.
Yeah, any infection. Once a sickler, in quote, is immunocompromised in other people who are AA and AS. So some diseases are usually commoner in them.
And pneumococcal infections.
Or organisms that are encapsulated in quote. So some sicknesses, even malaria, will trigger a crisis in these people. So infections, like we said, dehydrated. So that's why we advise that sickle cell patients, for generally, people should drink a lot of water. Because
sickle cell patients should drink more water.
At least aim for 6 liters of water per day. Every day.
Okay.
Israel is back from Abuja. Israel, we can hear you.
We can hear you.
Good afternoon.
My name is Israel from Abuja.
Okay.
All right, welcome.
Yes, I want to speak to the doctor.
All right, we can hear you.
We can hear you.
Okay, thank you very much. Good afternoon.
Good afternoon.
More grace.
More grace, sir.
I want to find out, is there any permanent medical cure for patients?
Okay.
So I've not seen, apart from many times that Papa came for them and the symptoms, but many times, it's possible, apart from spiritual aspects, because I've never seen any medical therapy that have done health.
All right.
Okay. Thank you, Mr. Israel. So, but unfortunately, I would say the doctors, we are still trying to work on that. There is no medical cure. Although they do this bone marrow transplantation,
gene therapy,
and gene therapy, they are going on. But
it's still not very conducive at this point. That's because now for sickle cell, now we do a bone marrow transplant or the gene therapy, but they need to look for a bone marrow that will suit your own or the person's own and transplant. And then after that, they'll keep the person on drugs because some people are going to react.
Because some might
because it's a foreign body that they are going to reject it.
Some might reject the bone marrow, the transplanted organ. That's
so
bone marrow.
as it is now, surgery can help in managing bone marrow. But there are some criteria that a person must meet before they can do a bone marrow transplant. An individual who has suffered a stroke. You know, sickle cell is one of the commonest causes of stroke in the young people. So if you see a young person who has a stroke, it's most like either sickle cell, HIV, or a brain tumor. So some of the criteria is that a person may have had a stroke, the person may have had more than 6 crises in a year, the person that should even have a bone marrow transplant done. The person has to meet some of these criteria and before it is suggested.
Matters. Less than 16 years of age can go for a transplant, but above 16 years of age,
you start running into issues for that.
So, Talking about the crisis, emotions and can also
now we said,
cause
dehydration, emotional instability,
stress, and all those can actually
trigger a crisis. Cold, the environment can as well trigger a crisis. When people, sickle cell patients in a very cold environment can trigger them to have a crisis. And many of these crises will come with pain.
Yes, that's it.
That's the commonest sickle cell crisis that we have. A vessel. That's because, you know, we have said that the cells, the red blood cell shape is not normal in quote like other people's own. So once there's anything that will reduce, okay, like it's on the screen, and those are sickle cells, those ones that have this abnormal shape.
They are sickle shape.
Yeah, and if you look at your blood vessel, it is round. That's your arteries and your veins that the blood flows through roundly like that. Does it have enough water, or there's anything that causes a lot of stress, this sickle cell will start to join together.
Yes, and that is what we call the vessel-occlusive crisis.
Once they join together, they don't pass through the vessel again.
They have this clogging, they clog together and they cannot pass through.
And once they cannot pass through, they can't supply oxygen to the tissues.
At all, of course.
That's what is now the cause of the shortage of blood that they have.
That's where the name sickle cell anemia comes in. So that what you just explained, the vessel-occlusive crisis, which is actually the main crisis for the sickle cell people. Also, they could have what we call effects also, and it's this pain in their chest, terrible pain in their chest. We call it what? Acute chest syndrome. They have pain in their chest. Some of them might not even be able to breathe. They may end up using the oxygen. Then others, they have the hemolytic crisis, which just explain where the blood cells die. The blood cell dies, exactly. Then there's the splenic sequestration crisis. In that one, all the bloods are pulled to the spleen, and they are kind of trapped in the spleen. So that patient do not have blood. The patient looks like paper white. And such patient can end up some patient end up having what we call
heart failure.
Heart attack.
They have heart failure because they are not there's no much blood now to be pumped to the tissues.
Heart failure, and it can actually cause death. And so such patient can also have what we call aplastic crisis. In this case, all the red blood cell, the white blood cell, all the bloodline platelets will just reduce very low, and it can actually cause the death of that patient. So you can see that this sickle cell issue is not something one should play with. We've not even talked about the bone crisis where they have severe pain.
Severe bone pain.
Something we know about this sickle cell crisis is that
some will have low-grade pain all through. And then when they now enter into a crisis, the pain is severe. It's not something that I had a patient one time, a young boy. He was 11. In fact, he had a bed in the hospital ward. When he goes to school, he falls into a crisis. He just enter a bike and come to the ward. In fact, when he comes, he will just tell the nurses, when somebody occupies his bed, he will tell the nurses that there's no bed for him. And they're like, look at bed. He say, no, you know my bed. So it was bad. He comes to the hospital almost every week. And it was consistently on painkillers also. It's not a funny situation. The parents end up wasting a whole lot of money. The child is in pain. You are giving blood.
In fact,
and you may now infect the child when you give not properly screened blood. It's not usually a beautiful scenario.
Exactly. In fact, there's a scenario where the children ask their parents, "Mommy, why did you bring me to this world?"
Yeah, well,
that's emotional, and that could overcome everything. When it
comes to that point, love, I don't think love can conquer that actually, because your child is in pain. You are spending a whole lot of money. Your
child might die, knowing the fact that you have a child and you think that child might die,
might not survive. Yeah, because in sickle cell, the irony is this: at a young age, crises are common. As they age, crisis may reduce, but complications become common.
Yes, and that complication might lead to what?
That's what, They may have, some of them may have priapism as part of this occlusive crisis.
And that one is really
You see, a young man without any sexual stimulation, has an erect manhood, and it stays like that, can stay for hours, can even stay up to a day.
Yes, and can actually
and it will cause destruction and render him infertile, even when he wants to give birth to a baby. Some of them can have chronic leg ulcers, a wound on the leg that refuses to heal.
Yes, as seen in the illustration.
And sickle cell is a common cause of kidney failure.
Yes.
In two ways, because one, the blood flow to from that, because they are chronically in pain, you give them painkillers, and some of these painkillers are going to destroy the kidney. So you see, it's one of the reasons why people will start going for dialysis. Sickle cell will cause blindness.
True. Also stroke.
It's the commonest cause of stroke in young people.
Of course. You see a little child,
a 3-year-old
3 years having stroke,
and then you start to wonder.
Yes, and some of them come with paralysis of part of their
body. Could this be preventable? Yes, is the answer. In the marriage class, Dajayola will always say that the destiny deciding question that you should ask on a first date is, what is your genotype? But many of us will not eat it today.
What's your best color?
Those funny things. Have you eaten? What did you eat in the morning? I have not asked a very critical question, because you will end up putting your emotions into that relationship.
Investing such emotions, then you realize that.
Imagine spending 2 years and you realize that you are not compatible.
Finally, maybe when the pastor comes and say, okay, apostle now come and say, let's go and do your sickle
genotype, and you find out that you're not compatible.
Then you start crying,
and we start believing God.
And we want to then believe in God and stressing our.
But I think some of these things can be nipped before they become serious like that. Yeah. So now, other complications that can arise for people who have sickle cell anemia,
many,
they can end up with heart failure too.
Heart failure or necrosis of what?
Now, basically, if you see a sickle cell anemic person, there are classical things that you will see that will make you know that this person is a sickler.
True. And this is very important. This is very important because some people do not know, some parents do not know if their children actually have it.
You know, I saw a child who came in, no, not a child, he was 32.
Okay.
An
adult.
An adult, 32, and had a stroke. He was seen, he did not have the classical sickle cell fascia or appearance. And then he had a stroke, but the blood pressure was normal. He had no other risk factor for a stroke. And the neurologist who saw just said, have you guys done a genotype? We did not do. I was a house officer then. We were just concentrating on a stroke, hypertension, causes stroke. And he's requested for a genotype. The guy was genotype SC, actually.
Okay. Classic cell disease, one of them.
Yes, he was SC and he suffered a stroke. Some people with SS too may not have the classical fascia, but they are still suffering the disease. The classical things that you will see.
Okay, yes, we have such people. You notice that they have this greenish tint in their eyes. We call
their eyes
jaundice.
Are always yellow or greenish yellow. They are jaundice.
Jaundice. Then also they are kind of stunted. For children, they look smaller than their age. They are they look slim.
They are slim. Their hands are long. They look longer.
Yes.
Their tummy. When you look at them, the classical SS, you will be able to know that this guy is SS.
And they always look weak.
Yeah, because they are anemic. They are anemic. Generally, they have shortage of blood. But the good thing about them is that they may have a low level of hemoglobin, a low amount of, will not survive with maybe PCV of 16, 17. But you see an anemic patient with 16 and is working. It's normal.
We call it the baseline.
That's their that's their stable state PCV.
Exactly.
But basically, you have some of these features in these people that can give it out that they are sickle cell anemic patients. But for those guys who are AS, you will not know because they are normal.
They might not know.
But they are just carriers of the gene, or they have the traits of sickle cell. They do not have the disease. They do not manifest the disease, but they can pass the disease to their children.
However, some few of them could manifest some little
small crises here and there.
Okay. Right now, we are going on a break. When we come back, we'll give you so much information on sickle cell anemia. Stay tuned and don't go far from your screen. Thank you.
What business are you planning to showcase to the world? That which will satisfy the need of humanity? Of course, with Celebration TV, it will get the desired reciprocation you long for. We are committed to giving your business and services that quality touch of class, and you will be happy you made the right choice by placing that investment of yours on the right platform. Without delay, you can call on this number for your advert placement, partnership, or sponsorship of our programs. Celebration Television, your best bet. What business are you planning to showcase to the world? That which will satisfy the need of humanity? Of course, with Celebration TV, it will get the desired reciprocation you long for. We are committed to giving your business and services that quality touch of class, and you will be happy you made the right choice by placing that investment of yours on the right platform. Without delay, you can call on this number for your advert placement, partnership, or sponsorship of our programs. Celebration Television, your best bet. What business are you planning to showcase to the world? That which will satisfy the need of humanity? Of course, with Celebration TV, it will get the desired reciprocation you long for. We are committed to giving your business and services that quality touch of class, and you will be happy you made the right choice by placing that investment of yours on the right platform. Without delay, you can call on this number in television, your best bet. What business are you planning to showcase to the world? That which will satisfy the need of humanity? Of course.
All right, glad to know that you're still with us on Celebration TV Health Talk today. We are still discussing sickle cell anemia, this compatibility, marriage issues that we talked about. Now, for individuals who do not have a compatible genotype, and they are probably already in a relationship and they've gone far, what do you think they should do?
They have to go back, reverse, turn and reverse. Very important.
Okay.
Because we just explained now, the complication, the psychological, medical, emotional, all this stuff, it's not fun at all.
Okay.
So
now what if people want to hide under the canopy of religion?
But the truth is the truth. The truth is the truth. Please and please.
And maybe what if it's the woman is God-given wife, in quote?
Okay. You know, God does not make a mistake. Okay. Whatever he gives, say God blessing added no sorrow. And this is obvious that God.
Okay. Now
he has given he has given the doctors, the medics, the wisdom to even get this gadget, this chromatography or whatever gadget that we use to check hemoglobin and to know. So why do you go forward? Why would they go forward to test God? Now,
unfortunately, we have seen some. Okay, we have a question. How can this disease be managed in the children?
Okay.
Well, yeah, sickle cell anemia is best prevented. Okay. Like you were saying.
Yes.
It's better if you know that your genotypes are not compatible, do not bring forth a baby. I've seen marriages that the couple decided that they are not going to give birth to children. Not in it doesn't happen common in Africa though.
You just know the next thing. In fact,
no, but it happens.
In fact, the next thing you are looking at the tummy like every month they will greet you. Until 9 months, good morning, good morning, good morning. Then when your mother-in-law start or your mother
it's fine. Now this person wants us to tackle this. How can it be managed in children?
Okay.
Now it's simple. If you already have a child who is genotype SS, you know that's a special child.
Yeah.
Go for regular follow-up. You must have a clinic that you attend. Yeah. You should have a hematologist that sees the baby. There are routine drugs that the child must take.
Okay. But before we get to routine drug, there are some responsibilities that the parents must take first before, of course, the doctors will go on in. Although we talked about the trigger factors, the parents should try and avoid the trigger factors.
Anything that will trigger
anything that will trigger
a crisis,
like stress, dehydration, infections. So such child, then also, such child should be given what? Immunization, pneumococcal immunization and other immunization against what? Infection. Then water.
Child must sleep under the mosquito net.
Good. And take adequate water.
Child must drink water. That's not a child that will go to school without having a bottle of water. Yes. Child must drink, like we said, we aim for like 6 liters of water every day. Child must take water continuously. Child must be on drugs. Yes. There are medicines that will give for prevention of malaria. Yes. Proguanil. Child must be on proguanil every day. Must be on folic acid every determine whether your child should take them. Hydroxyurea, sickle, depending on the age, cyclavit, and all that.
And the child shouldn't go to school. When the weather is cold, shouldn't go to school without a cardigan. This is not the child that you forget.
Protect the baby very well.
If you forget that cardigan, please drive back to that school.
And take.
And put
that child.
The cardigan.
That child is a special child, so needs special attention, care, and some pampering.
Of course, that's in the home level, like then thereafter, when as you said, clinic visit. You shouldn't play with clinic visits.
Regular clinic
visit. And if there's a situation of a crisis, probably take the child to the hospital. Yes, you pray. While you pray, you take that child to the hospital, please. Because if you watch the child there and you want to self-medicate or you do nothing, that child might die in front of you.
And there was a question, it says, how often should they go for checkup? For HBSS, okay, so how often should one with the disease go for checkup? Every 3 months. They should have a PCV done. That's to know how plenty their blood volume is. They should do a PCV every 3 months, and then they refill their drugs. They take more counseling and probably add.
The child is sick or not,
they require
always go
a
for checkup.
Of course. All right. Now back to the question. Now we've said that if you look at these 3. One who is AS and another who is AS, ideally are not compatible.
Exactly. And one who is SS and the other partner is AS, also
they are not compatible. Is it possible to detect this disease even in little babies? Yes, now it's becoming possible. We now do. No, we said that sickle cell begins to manifest when the child is 6 months and above. But nowadays, there are newborn screening that is being done. That even as baby is born, before they leave the hospital, some investigations are done. Sometimes it's even possible to do a prenatal screening while you are still pregnant. I wanted to take you to that angle. That what if the person decides, the couple decides to get married and say, okay, we'll do prenatal screening when we are pregnant. We find out if the baby is going to be SS. Because I know. So it's possible to detect the disease even in little babies. It's possible. But for the common test that we do, it's usually from 6 months and above. But we can do newborn screening. But the child will not manifest until they are 6 months. Just know that. So you shouldn't cut your joy short that by 3 months, child is not sickler and you're happy. It may just eat 6 months and starts to manifest. There was a baby I saw. Child was 8 months and came. Child was pale. And then we found out history. Father did not know genotype. Mother didn't know. We screened and baby was SS. It is worse for children who manifest early enough. They are usually going to have a very turbulent life. If a child comes like 2 years before you detect it, usually better. Like for someone that you pick up by 6, 7 months, 8 months, they're usually going to have problems. Their disease will run a more aggressive course.
Okay, on the screen we have the medical genotype chart for intending couple. In case you want to get married, you need to see this. Please look at your screen and see this. AA of course, can marry AA, and they have the beautiful combination of all AA, hemoglobin AA.
Yeah.
AS and AS can also get married.
AS and
AS,
AA.
sorry, and AA, what am I saying?
AS and AA can get married.
AA can get married, no problem. But AS and AS,
No.
no, please do not get married.
AS and SC.
Okay.
SC, not too common though. AS and SC
should not marry.
Now,
No.
you know they can bet an AA and an SC.
That SC
It usually
just
runs
like
a
an SS.
mild course. No, SC runs a milder course compared to SS.
However,
And
they
SC
still
is
have
not
crisis.
as common. Yeah, they do have crisis.
They have
do
crisis,
have crisis.
and they
yeah.
have it's not fun.
Yeah.
Sincerely speaking, you know, I had there's a patient of mine, actually more than a patient, like a relative, who had SC.
Okay.
The crisis was it's always so bad.
Like an SA.
I'm telling you,
yeah,
I'm telling you, she had
common,
this,
yeah.
this necrosis of the femoral joint. I'm telling you,
That's
SC.
bad.
SC.
It can happen. So that's why even once it is SC and AS, we still tell you.
You cannot.
So just aim for, once you're AS, start aiming for AA.
Exactly.
Just start aiming for AA.
SS.
Start aiming
So
for
people
AA.
that have AA, somebody say hallelujah.
Yeah, that, you know, that's why some of us, yeah, we
And
have
please
this.
do not be stingy.
We have this joy that
Do not be
we are
stingy.
AA.
Save the world. If you are AA and you see an AS person, AS
Should they marry out of
who you want to
sympathy?
marry, please. No, what I mean, don't be stingy. Some people, they will just love the person and say, for the sake of my children, I cannot have all AS. No. I'm not going to marry him.
Okay, you now aim for another AA.
Aim for another AA because you want to be stingy. Don't be stingy. Save the world. Because if AS gets married to AA, they'll reduce what? That S, hemoglobin S. And before you know, this the issue of sickle.
It will come down.
It will come down.
To a large extent, yeah.
It will come down. So
I
please,
agree.
freely accept his proposal. That's if it's the right one.
All right, that's fine. Now, in general, we have said if we have been able to identify those who are already in the situation, they are SS now. Yeah. Now a lawmaker in this country, as of last year, he is a former governor of one of the states, a senator. He brought out a bill. Sickle cell prevention, control, and management. Okay. It has scaled through second reading, actually. His aim was that let us prevent AS and incompatible genotypes from getting married. Like, serious? Yes. It has not passed the third reading now, but it has passed second. As of May last year, it has passed the second reading. You know, sickle cell, it's a big deal. Yeah. Is it your advice on how sickle can be prevented? It's simple. Do not marry a genotype that is not compatible. Exactly.
We just talked about it now.
That is just the basic. It is very preventable when you marry right. You know, it's a disease. It's a disease of sickle cell disease. A disease of poor selection. When you select your partner poorly, you are going to have problems like this. So if you select well, that's just the only preventive way. Except you say the child already has, then we can tell you what you can do so that the child will live a healthy life.
Because in as much as this is a scourge and it's sad, I've seen patients who are kind of 80 years old and above, having this sickle cell disease, meaning they survived it.
Yeah, it's possible.
80 years and although.
But you know why? You know, some of them usually the level of hemoglobin SS that they have may be low. You know, some of them will carry on with hemoglobin F. That's the one that a fetus is supposed to have. Some of them may have it carries it into adulthood. And it gives them some form of protection. Exactly. So that's why you see some SS not coming in a crisis every time. Okay. You want to term them lucky. Okay. Some SS are lucky. They do not come with crisis every time, and that is because either their level of the hemoglobin S is reduced, they have some other hemoglobins that are protective, but not A. Yes, not A. Either F, most times. Or they are doing things enough to avoid triggers.
That is it.
Yeah, if you avoid the triggers,
it will, the propensity of this
crisis will reduce. So when you take a lot of water, you use all the drugs that you are told to do, you go for regular checkup, you eat healthy, you're going to avoid coming down with crisis every time. Yeah.
Right now, we're going on a break, a short break. Please stay transfixed on your screen. We'll be back very soon. Thank you.
What business are you planning to showcase to the world? That which will satisfy the need of humanity? Of course, with Celebration TV, it will get the desired reciprocation you long for. We are committed to giving you made the right choice by placing that investment of yours on the right platform. Without delay, you can call on this number for your advert placement, partnership, or sponsorship of our programs. Celebration Television, your best bet. What business are you planning to showcase to the world? That which will satisfy the need of humanity? Of course, with Celebration TV, it will get the desired reciprocation you long for. We are committed to giving your business and services that quality touch of class, and you will be happy you made the right choice by placing that investment of yours on the right platform. Without delay, you can call on this number for your advert placement, partnership, or sponsorship of our programs. Celebration Television, your best.
All right, welcome back once again as we gradually wind down on sickle cell anemia. Now, it is important to note that sickle cell anemic people need to be treated with empathy.
Yes.
Yeah, because they are just the same as we are. Yeah. The only difference is that they carry a genotype that you are not carrying. Yes. So they need all the empathy. Put yourself in their shoes, rather than stigmatization.
You should show them, the families, people around should show them love.
Yeah.
Show them love, show them care, but do not see them as outcasts.
As sick people, in quote. Because
quotes.
Many of them, that's why the word sickler, it's not a nice term to call those people. Because it's not every time that they are even sick.
Yeah.
It is only at the points where they have crisis. And if they can prevent this crisis, they won't even fall sick, and they will live a fairly normal life.
True.
Yeah.
True.
And then a question there was, does it have a cure? We have said it before, that there's a cure, but it is a bone marrow transplant.
Yes.
Or at the gene level, a gene therapy. But it's not as common.
Yes.
At this point. They are quite expensive and they have their own complications too that come with them. Some of them may even fail when you do them. So they are, in this part of the world, we are still managing and managing. But yes, there is a cure, but it is a bit expensive. Yeah.
And also, management is also very important.
Yeah.
So we just talked about it, that some even live to 80, 90 and all.
It's possible.
Once you do the right thing, you manage and all,
Yeah.
the person would live long.
Yeah. For children who are under 5 years, we give them prophylactic antibiotics. They take antibiotics and hemophilus that cause severe chest infections for them,
which might lead to death.
Which will lead to death. Yeah.
Exactly.
So for them, once they are taking a lot of water,
yes,
they are taking drugs as prescribed. They are using anti-malaria prophylaxis to prevent malaria.
Vaccination.
So if you have a sibling or a friend who is HBSS, they need all the support that they can get.
Love.
When they fall into a crisis, it's not a time for you to complain.
No.
Show them love. Take them to the hospitals if need be. If it's crisis that they can manage at home, it's fine. That's a question. Say, I mistakenly drank a medicine I was supposed to only put in my mouth and gargle for 5 minutes and throw out. What is the first aid for it? Meanwhile, I am weakened. What can I do?
Drink lots of water.
He said he was supposed to gargle with it for 5 minutes and throw out. We don't know the medicine. What is the medicine in the first place? Yeah. Is it for oral thrush? Exactly. If it's fluconazole, for example, you are treating oral thrush.